Hi, everybody. How are you? Thank you so much for joining me today. It's Friday, right? I guess for a lot of you, every day's Friday, right? Which is good. It's all good. It's good. So my name is Brian, and I'm with Blue Cross Blue Shield. I'm a Medicare educator. I'm on their consultants team. There are 6 of us that go throughout the state, and we just educate people about Medicare. This right here is one of our more popular presentations. This is not a Blue Cross presentation. I'm not going to talk about rates. I'm not going to talk about plans for next year. That's coming in a couple of weeks. We actually, I'm not sure you know this, but legally we can't tell you anything until October 1st. So I know, right? But I noticed somebody, I think it was yourself, came in with your Medicare and You book. That should be arriving in your mailbox this week. Those have all the rates in it. So you guys actually know all the rates before I'm allowed to tell you. So that's really good. So we won't talk about rates today, but we're going to talk about the difference between Medicare supplements and Medicare Advantage plans. So this will help you when it comes time to make a decision. You can only choose one or the other, and I'll tell you what the differences are between them. We'll just go through a bunch of stuff, and I'll try to make it fun. I don't try not to be robotic or anything, so I'll be a little bit goofy, and we'll have a little bit of fun with it. Let's see, what else? I think that's it. Everybody here from the area, from East Longmeadow or the local area? Okay, good. All right, awesome. Well, thanks for coming out here. I appreciate it. So this is our agenda. We'll talk about I'll tell you something about original Medicare. You may have heard of it, you may not have heard of it, but we'll talk at length about that, and then we'll go right into Medicare supplement plans. We'll talk about Medicare Advantage plans. I'll do a comparison chart. We'll do a case study. I'll talk about prescription drug coverage and how that works. Now, all the information I tell you today is across the country. It's for everybody in the country. It's not just Blue Cross. It's not just Massachusetts. But I'll tell you if there's anything that is just for us here. Things to consider, and I'll give you some phone numbers and websites that you might be able to use in the future. So we begin all our presentations with this box here, with this slide. So that navy blue bar across the top there, that talks about the starting point. Everyone begins their Medicare journey at that blue bar. And it says that you have Medicare Parts A and B. So when you have Medicare Parts A and B, you're Medicare eligible. And you become Medicare eligible 2 ways. You either turn 65 or you are younger than 65 and you're in your 25th month of disability. Medicare Part A is given to you by the government at that time, as long as you've paid into Medicare for 10 years or 40 quarters. And that means that you've had Medicare taxes taken from your paycheck during those 40 quarters in your lifetime. So once you have Medicare Part A, kind of sits in the background, doesn't do very much. It really doesn't activate until you purchase Medicare Part B. And you would purchase Part B when you don't have insurance. So you could work, you could be age 65 or beyond and still be working, or your spouse could be working. As long as you have access to insurance through an employer, you don't have to activate Part B. But it's when you don't have insurance that you're going to do that. You're going to pay for Part B, and then A and B kind of hold hands. They step to the foreground and they say, okay, now because you have A and B, you can purchase a Medicare supplement plan through a company like Blue Cross, or you can purchase a Medicare Advantage plan. You can't have both. You can only have one or the other. So I'm here today to tell you what they are and how they're different. Medicare supplement has 2 boxes here because Medicare supplement plans or Medigap plans don't have drug coverage built in. So you have to purchase a separate drug plan. So you might have a Medicare supplement plan with a company, and then you have a separate drug plan, either with the same company or a different company. That's how that side works. And then we'll talk about Medicare Advantage plans. There's only 1 box there because drug coverage comes built into a Medicare Advantage plan. Okay, so you don't have to purchase a separate plan. So you have one or the other. But before we talk about those plans, I'm going to tell you about Original Medicare. So Original Medicare, whether you know it that exists or not, is something that you had before you decided you wanted to choose a plan with a company like Blue Cross or United or Health New England or whoever it might be. Original Medicare was given to you by the federal government. It allowed you to see any doctor nationally who accepts Medicare. It doesn't have referrals and it doesn't have networks. They sent you a red, white, and blue card just like that. The card had your name, They assigned a number to you, and then it has two dates on it. It has the date that you started Medicare Part A, and it has the date when you started Medicare Part B. They could be the same date if you started them at the same time, or like I said before, you could have been working, or you could have had insurance through an employer, and you may have waited a year or two. So that Part B date could be different. But anyway, that's your Medicare card. Original Medicare does not include prescription drug coverage, but it covers two parts of Medicare, the two parts of Medicare being Part A and Part B. There's a lot of responsibilities you're going to have on Original Medicare, which is why probably all of you said, I'm going to go with a plan with Blue Cross or whoever it is that you have your plan with, and that plan's going to replace what I'm going to talk about here. So I'll talk about Original Medicare, I'll tell you what your responsibilities would be if you kept Original Medicare, and then you'll understand why you probably didn't want to keep Original Medicare, you wanted to go with a plan with a company. Part A is your inpatient hospitalization insurance. It covers when you go overnight in a hospital. It also covers when you leave that inpatient stay and you go to a rehab facility for skilled nursing. And the way it works is Part A, as I told you before, is premium free for most people. As long as you've had those 10 years of Medicare taxes paid by you, you're going to get Part A for nothing. And they're going to give you that when you turn 65 or when you become Medicare eligible. What happens with Part A on Original Medicare is if you go overnight in a hospital, you're responsible to pay a deductible of $1,676. And that can happen more than one time a year. And the way that can happen is if you go overnight in a hospital, let's say you have a 3-night stay, you're going to pay that deductible. If you are discharged and more than 61 days or more elapse from the time you leave to the time you go back in, you're going to pay that deductible again. So that can actually happen 2 or 3, maybe 4 times a year, depending on timing. You're also going to pay coinsurance if you're inpatient for 60 days or more. That's a long inpatient stay. 60 days is unusual, but it can happen. And it's my job to tell you that if it does happen, you're going to pay a copayment each day starting on day 61 all the way up to day 150. And if you're in the hospital for more than 150 days, you have no coverage under Original Medicare, so you have to pay everything that they charge you. So that's Original Medicare, and that's how Part A works. If you go into a skilled nursing facility after you leave the hospital, the government's going to pay for the first 20 days that you're in a rehab facility. That's the way it always works. So you won't pay anything for your first 20 days. If you're in a rehab facility for 21 days or more, you're going to start paying a copayment on day 21 all the way up to day 100. And then after 100 days, you don't have coverage. Part B is your outpatient care and everything else that doesn't involve inpatient hospitalization. Think of everything medically that would happen besides inpatient care. You've got all your outpatient care. You have a doctor's visit, specialist visit, ER, urgent care, tests, diagnostic testing, x-rays, all your rehab, physical therapy, speech therapy, all those things are durable medical equipment. All those things make up Medicare Part B, which is why they charge you for it. Everyone here is paying for Part B, and you're paying this year in 2025 a monthly premium of $185. That's for most people. If you claim more than $106,000 in modified adjusted gross income to the IRS, you'll pay more for Part B. And if you're filing jointly, and between the two of you, you declare more than $212,000 in modified adjusted gross income to the IRS, you each will pay more for Part B. But most people are paying $185, and again, they charge you for it because it covers everything outside of inpatient hospitalization. Now, if you have Original Medicare and you don't have insurance with another company, your responsibility, besides those responsibilities I told you about on Part A, you have two main responsibilities with Part B. You have a one-time annual deductible of $257. That's payable one time. Once that's paid, you don't have that anymore for the rest of the year. However, the next responsibility and the last responsibility you have under Original Medicare might sway you to decide that you don't want it and you want to replace it with a plan with United or Blue Cross or whoever you might have. And that would be that you are on the hook and responsible to pay 20% toward all your services you incur for the remainder of that year. Now, I've had people come to presentations and say, well, that means the government pays 80%. That's totally fine. I'm good with that. All right, well, if you go to the hospital for a week or two, and let's say that bill goes to your home and it's $100,000, the government will pay 80% of that. So they'll pay 80 grand, right? But then guess what happens? That gets put in an envelope and it goes right back into your mailbox if you have original Medicare, and you've got to pay $20,000. That's a lot. I know I don't have that kicking around. So I tell people 20% doesn't sound like a lot, but if you're a high utilizer and you're a frequent flyer and you're always going in for this and that, 20% can add up. So that's original Medicare. Remember, that's the government's insurance they give you when you turn 65 or when you become Medicare eligible. But a lot of people say, I don't want that 20% following me around all year. I want a company like Blue Cross to pay for that. So the first option, remember on that left side of that slide I showed you where there were two boxes, your first option would be to go on a Medicare supplement plan. What's a Medicare supplement plan? It's also called a Medigap plan. It's a plan that you would join with a company like Blue Cross where we take over that 20% and we pay those deductibles and gaps for you that you would be responsible to pay on original Medicare. So it's a secondary insurance plan that you add on to original Medicare with a company like Blue Cross. Monthly premiums for a Medigap plan or a Medicare supplement plan range anywhere from $120 a month to $260 a month per person. These are all individual plans. So if there's two of you, you could have one, your spouse could have one. You don't have to have the same plan, and you're gonna pay separately for your plans because they're individual plans. Medicare remains primary, so the 80-20 situation still exists, and the government is still going to pay their 80%, but the supplement plan that you join pays the balance that Medicare doesn't pay, for example, the 20%. So if you leave original Medicare and join a Blue Cross plan, say at one of our supplement plans here, a Medigap plan, that 80% is going to be paid by the government, and then instead of them sending that bill to you, they send it to us. And we say, okay, they've got a Blue Cross card, so you're going to show your Blue Cross Medicare supplement card and your Medicare card, your red, white, and blue card when you go to the doctor, because the office manager is going to know to send the bill to the government so they can pay 80%. And then they're going to instruct them, don't send it back to them, send it to us, send it to Blue Cross, because they have our card, they have our plan. So we're going to take care of that. You can see any doctor in the United States who accepts Medicare for anything. There's no referrals necessary, and there's no co-payments. I like to talk about my dad. When my dad was alive, he was a redheaded Italian. He was very aggressive, and he wanted what he wanted. And he used to tell me, I want a plan where I don't have to pay co-pays. I want to go to the doctor, I want to leave my wallet in the car, and I don't want to pay anything. So this was the plan for Dad because he didn't have any co-pays, right? So whenever he went to the hospital or to the doctor, or whenever he had an emergency, he didn't have to pay those co-pays that you would normally pay on the Medicare Advantage plan. So I'm not saying that's better, but it was good for him because that's what he wanted. So that's how the Medicare supplement plan works. Now, in Massachusetts, yes, ma'am.
What about deductible?
The deductibles are covered by us, as long as you have the plan, have a plan that doesn't pass that responsibility along to you. I'll talk a little more about that on the next couple slides, so we'll answer that in full, I promise you. In 47 states, they offer 10 Medicare supplement plans. I can tell you right now that if you come to one of our sales seminars and I stand up in front of you and try to tell you about 10 of these plans, you'll want to tackle me and tell me to stop after 3 or 4 because they're boring, right? In Massachusetts, Minnesota, and Wisconsin, we can offer you as many as we want or as less as we want. In Massachusetts, there are 3 Medicare supplement plans, not 10. So that's really good. So every company in Massachusetts that offers these, United, Health New England, Blue Cross, Tufts, we offer 3 Medicare supplement plans, and they're the 3 same plans. Supplement Core Plan, which is the least expensive plan, Supplement 1A Plan, which is middle of the road, and then Supplement 1 Plan, which is the most expensive plan. We call our plans MedX, so you're going to have a MedX Core. We call this MedX Sapphire, and this is MedX Bronze, but that's just what Blue Cross calls them. Now, the Supplement Core Plan is the least expensive of the 3 plans, and when you're paying the least amount of money, you're going to have the most amount of responsibility. So this is going to answer your question a little bit more that you just asked here. Supplement Core pays the 20%. So do the other 2. That's the primary reason why you want to choose one of these plans. You want that 20% taken care of. So all 3 plans pay that 20%, but the Supplement Core Plan doesn't pay certain deductibles. like the question you just asked a moment ago, that $1,676 deductible isn't paid for by the core plan because it's the least expensive plan. So they pass that responsibility along to you. So that is actually outstanding there. When you go to the 1A plan, the only responsibility you have besides the monthly payment is that $257 Part B deductible. So if anyone joins the Supplement 1A plan in Massachusetts, you only have two costs all year. You have your monthly premium, whatever that might be, and you have that one-time $257 deductible. On the Supplement 1 plan, or our Bronze plan, this is the most expensive plan, so of course everything's going to be covered. This plan covers everything at zero. This is the plan I put my dad on because he didn't want copays. So if you join the Supplement 1 plan, or our Bronze plan, it covers everything. You only have one responsibility, and that's your monthly premium. So you're going to pay your monthly premium, and that's it. You're not going to have any co-payments for the rest of the year. The really important thing to remember, regardless of which of the 3 Medicare supplement plans you join, is that there's no prescription drug coverage. So we've all heard of Shine counselors. There is a Shine counselor assigned to just about every senior center in Massachusetts. There might be more than one. This senior center has one or two. Definitely see them because they're going to be able to help you sign up on a prescription drug plan if you join a Medicare supplement plan, because that's your responsibility. It doesn't come with drug coverage. So if you join this plan, you're going to have to join a drug plan too. So definitely see a Shine counselor, make an appointment and say, I'm joining the Blue Cross MedX plan. I need a drug plan. There are probably 12 or 14 of those in Massachusetts you can join, so they'll help you find one. Now, we're going to talk about Medicare Advantage plans. Remember that first slide where there was a box all the way to the right and it was just one box? That's the Medicare Advantage plan. Those plans are the plans we're kind of used to. We've had managed care in America for maybe 40 or 50 years where we've had primary care physicians, we've had referrals, we're used to that, co-payments. That's how these plans work. Now there's an acronym there of MAPD. I don't like acronyms because we have to assume that people don't know what they are, but I'm going to tell you what that means. What is a Medicare Advantage plan? It says MAPD. That stands for Medicare Advantage with prescription drugs. So if you ever see that acronym again, you'll know what that means. That just means you have a Medicare Advantage plan. It's a private health insurance plan with a company like Blue Cross Blue Shield who has a contract with Medicare to take over and administer your Medicare benefits. That 80-20 deal goes away with Medicare Advantage plans. The government doesn't pay your claims at all. What happens is if you join a Blue Cross plan, you have our Medicare card, you're going to show that to your doctor, they're going to send the bill to us. They don't send it to the government. We take care of you. We take care of everything. Carriers like Blue Cross offer multiple plans, and some have monthly premiums as low as $0. So we have what's called a $0 plan, where you can join a Medicare Advantage plan, have all your claims paid for, get prescription drug coverage, and it doesn't cost you anything. Now, when it doesn't cost you anything per month, your copays are going to be a little bit higher. So your responsibility will be a little bit more, but you know, everybody can afford zero, so that's always a good thing. You're only going to show your Medicare Advantage card when you receive care, like I said, because those bills are going to come right to us. Medicare Advantage plans cover all Medicare Part A and B benefits. Remember those deductibles I just told you about? Those all go away. With a Medicare Advantage plan, it just works a lot differently. Those go away. That's nobody's responsibility anymore. And the most important thing to remember, Medicare Advantage plans may include non-Medicare covered benefits. Benefits that original Medicare won't give you, like preventive dental exams, routine eye exams, routine hearing exams or hearing aids, and finally, most importantly, prescription drug coverage. That's built into these plans. So you're going to get that coverage without having to go out and find a separate prescription drug plan. Yes?
I think with the Advantage plan, you have an annual deductible of $6,000 something.
So that's not a deductible, that's called an out-of-pocket maximum. And what it is it's almost like a stopgap measure where they assign the number that is the most amount of money you'll pay for all your services in a year outside of your prescription drug coverage and your monthly premium. So an out-of-pocket maximum is not a deductible. Remember, a deductible is something you pay before your plan pays for something. An out-of-pocket maximum might be $6,000 or $6,700 is more common. That might be the most amount of money you are responsible to pay for out-of-pocket in a year on your plan. So that's actually a good thing. The deductible is where you keep paying. An out-of-pocket maximum is the most you'll pay in a year for something. So you're right, all Medicare Advantage plans have an out-of-pocket maximum, and they might be a little bit different from plan to plan. They might change. One might be as low as $3,000, one might be as high as $10,000, but they're usually in that range in between there somewhere.
So your copay when you go see a specialist or somebody,
Yep.
that adds up.
It does. Not to $6,000 unless you're a crazy high utilizer, but a lot of people won't hit that, but some people might if they go inpatient and they have those high co-payments. But it's good to know that you know that. Thank you for bringing that up. That's good information. Now, Medicare Advantage plans in Massachusetts, actually anywhere in the country, they can offer HMO Medicare Advantage plans and they can offer PPO Medicare Advantage plans. HMOs are the ones I told you about earlier, a health maintenance organization. You would designate a primary care provider, the doctor who is the gatekeeper of your care. You would have referrals sent to us anytime you have specialty care from that doctor. You would use in-network providers for most care. I like to say that HMO plans have a fence. We kind of have to stay in the yard. We got to stay with the hospitals and the doctors that are part of that network. And then you're paying co-payments and or co-insurance. Co-payments are when you see a dollar sign. Let's say it's a $40 copay. That's a co-payment. If you see a percentage for something, usually with high-priced drugs, you might have a responsibility to pay 33%. That's co-insurance. So that just means you're going to pay 33% toward the retail cost of that drug if it's expensive. So that's the difference between those two. If you have an HMO Medicare Advantage plan, you don't have to designate your primary care provider, but we ask that you let you know who your doctor of choice is, your provider of choice. That's just in case we have to communicate with them about getting a letter of medical necessity or getting some sort of medical notes from them. We just know who to contact. There's no referrals on a PPO plan because there's no primary care physician required. You can use in-network or out-of-network doctors. That's what PPO plans do. They let you go out-of-network if you need to. So if you know you have that one doctor or that one specialist who isn't part of the Blue Cross HMO network, then you're going to have to choose a PPO plan because it's the only way we're going to pay that claim is if you have that PPO plan that would allow you to go out-of-network for that service. Generally, you're going to pay a little bit more for PPO plans because they allow you to have that out-of-network care, which an HMO plan won't. So if you choose a PPO plan, you might pay a little bit more, a few dollars more a month for the plan. But an HMO plan, again, would allow you to stay in a network and see those doctors in that network. Now, here's just a comparison chart. On a Medicare supplement plan, coverage is provided by Medicare. They remain primary, which means they pay 80% of everything, Medicare being the government, and then the supplement pays the 20% left behind. On a Medicare Advantage plan, the plan you join contracts with the government to administer your benefits. That means the government won't get involved. We pay your claims. Plan options on a Medicare supplement plan, remember I told you there were three, a core plan, a 1A plan, and a 1 plan in Massachusetts. The prices range anywhere from $120 for the core plan or so, all the way up to $250 or more for the Medicare Supplement 1 plan. On a Medicare Advantage plan, we have HMO plans and we have PPO plans, and the prices can range from zero, we have those $0 plans, all the way up to over $100 or thereabouts. Are there network limitations on a Medicare supplement plan? No, you can see any doctor in the country who accepts Medicare. On a Medicare Advantage plan, yes, you do have a network that you have to stay within. Remember, it's either an HMO or a PPO network, and some plans, like the PPO plans, allow you to go out of network. Are there referrals required? Supplement plan, no. Medicare Advantage plan, no, unless you're on the HMO. Then yes, you do need to get referrals for specialty care. You don't have to get them. Your doctor will send them to us. Let's see, is there routine dental, hearing, or eyewear with your plans? There is not on any of these plans except on the Medicare Advantage. You're going to get dental, vision, and routine hearing typically built into your plans. Does your plan include prescription drug coverage? It does if you join Medicare Advantage. It does not if you join Medicare Supplement or MedX. And remember, if you join that plan, see a Shine counselor or get your, so you can get your drug plan as well because you'll need that coverage. All right, now it's time to pick on somebody. Who wants to be picked on? I'm going to pick on you. What's your first name?
Lou.
Lou? Yeah. Thanks, Lou. You're a good sport. I don't mean to put you on the spot, but this is for the benefit of the case study. So I don't love this case study, but I'll tell you why, but it'll give you a great illustration as to how these plans work. So Lou was kind enough to let us assume that she's on our Medicare Supplement 1A plan, which is our Sapphire plan. So Lou has two responsibilities financially if she's on this plan. See her monthly premium, $210 a month. All right, times 12 is $25.20. So Lou's going to pay that in a year for her Medicare Supplement 1A plan. And then she only has one responsibility all year. Look at all this. Oh, Lou, you had a busy year. You had 5 PCP visits, 5 specialist visits, 3 lab tests, 2 MRIs, 6 PT visits, 1 outpatient surgery. But she only paid her deductible of $257 because that's all she's required to spend. So she paid $25.20 for her premium, $257 one time, paid all zeros for everything else, and you can see what she paid for the year for her plan. This plan's really great if you're a budgeter. I'm kind of a dork. I'm like OCD, so I write everything down. I make little spreadsheets, and I need to know what I'm spending on things. If you're the same way, then you're going to love this because you just have that premium, that $257. So there's your bottom line. Lou, that's what you paid for the year. Now, we're going to move to the Medicare Advantage plan, or any Medicare Advantage plan, but Lou, just for the sake of this example, joined our Medicare Advantage PPO plan with Part D prescription drug coverage because it's built in. Now look at Lou's monthly premium, $75 for this plan, so it was a lot less. Times 12 is $900, so for the year, Lou paid $900 to be on this plan, but all those same visits that she had that were zeros on the other plan, she actually has co-payments because Medicare Advantage plans have those co-payments. So her 5 PCP visits are $50 because they were $10 each. Her 3 lab tests were $30. Her 5 specialist visits were $40 each, so that was $200. 2 MRIs, $650. Lou, I'm just going to knock on wood that you don't have all this happening this year, all right? But look at the bottom line. So with all that being paid, she paid $2,250 for her plan. Now, I told you before, I'm not a huge fan of this case study because it doesn't tell you one primary thing. If we go back to the Medicare Supplement plan, what is missing here? What is Lou going to pay for next year that's not on here? Her drug coverage, right? Because she has to have that separate drug coverage. Now in Massachusetts, you'll see on a future slide that our average cost of a drug plan in Massachusetts is about $38. Let's say it's $40. So if Lou pays $40 for a drug plan times 12, that's $480. You're gonna have to add that to there. So now she's over $3,100, almost $3,200 for the year with her drug coverage and her health plan, right? If we go to the Medicare Advantage plan, it's built in. However, let's just say, I don't know, I don't want to jinx Lou, but let's say Lou had to have 16 PT visits, right? We're going to add another $200 on there because that would be 20 times 10 more visits. So we're going to add 200 there. Let's say she had 2 outpatient surgeries. We're going to add another 300 there. Another lab test would be another $10. You know where I'm getting at. So let's say she had more, more than it's listed here. That number would be a lot higher. So whereas on this slide, well, wrong button, right here, they would still be zeros because she's not paying copays. You see what I'm saying? So this number could be different, but for the sake of the example, we're going to stay with $2,250. So this kind of just shows you as an example, you're paying for copayments here, you're not paying for copayments on the other plan. So again, not a huge fan of the case study, but it does allow you to see the difference between two. And thank you, Lou, for being a gracious participant. Appreciate it. All right, so now we're going to talk about prescription drug coverage, Part D. Always remember, Medicare Part D equals drugs. D is drugs, and you'll remember that forever. Standard outline of coverage determined by CMS. CMS is the government, the Centers for Medicare and Medicaid Services. The Medicare new book that somebody brought in, if you flip that around, when you go home and you see it in your mailbox, if you turn that book around, the CMS logo is on the back. The government prints that book and they send it to you. So the government, CMS, they regulate everything that has to do with Medicare. So they actually regulate what we can do, what we can offer, what we can say, but they also want us to regulate how we offer you your drug coverage. They want us to offer you your prescription drug coverage in 3 phases: deductible phase, initial coverage phase, and the catastrophic phase. and I'll explain what those are. So everyone across the country is going to have their drug coverage provided in those 3 phases. The deductible phase means that you might have a deductible on your prescription drugs. It might be $590 this year. If you do, you're going to pay the first $590 toward the retail cost of your drugs. Once that's paid for, then you jump right into the initial coverage phase. Your deductible responsibility is done. If you don't have a deductible on your drug coverage, and you might not, then you're just going to leapfrog over that deductible phase and go right into the initial coverage phase. The initial coverage phase is what we're all used to. It's the phase when you go to the pharmacy or to the supermarket and you get face to face with a pharmacist and they give you your prescriptions and you pay copays. So you show them your credit card or you pay cash or however you want to pay for your drugs. You're paying for your prescriptions in the initial coverage phase. Now, the catastrophic phase, not my favorite choice of word because catastrophic invokes fear and panic, but that's not what it's designed to do. The catastrophic phase just means in 2025 that once you've paid $2,000 out of your pocket toward your drugs while you're in the initial coverage phase, you've hit the catastrophic phase, and all your drugs, no matter what they are, no matter what they cost, become no cost to you at that point for the rest of the year. Now notice I didn't say F-R-E-E. They don't like me to say F-R-E-E because nothing is F-R-E-E in life, right? But that's why I'm careful when I say the catastrophic phase means that you've paid $2,000 out of your pocket for your drugs, and at that point, all your drugs become no cost for the rest of the year. And that's true. They lowered it. It used to be $8,000. And in 2025, they lowered it from $8,000 down to $2,000, which is great. So now some of you might hit it and get your drugs for no cost for the rest of the year. Now, deductible cost sharing, so whatever your deductible might be, if you have one, whatever your cost sharing or whatever your co-payments might be, the formulary, which is the list of drugs that your particular drug plan covers, and what pharmacy network they use, all those factors can vary, and they actually make up whatever the cost might be for the plan. So there might be 12 different drug plans in Massachusetts. They might charge different rates because all those factors determine what they charge. So you're gonna find different plans have different costs. Now remember, you might have drug coverage built into your Medicare Advantage plan. You won't have to worry about that. Medicare supplement enrollees can purchase standalone plans for private insurers. You almost have to because you don't have drug coverage. So you have to purchase a plan from a private insurance company. There's a wide range of premiums available. The national average for a drug plan is $46.50 a month. In Massachusetts, it's $38, so we're a little bit lower than the national average. The lowest plan is $12.90 this year. The highest plan is over $100. Now the $12.90 plan is less expensive, but they might have a really small formulary. So that drug that you take that might be expensive may not be on that formulary. And at the bottom you can see the orange lettering. Always check formularies to see how your medications are covered. Whereas if you're paying $38 or more for a plan, they might have a larger formulary where your drugs will all be covered. You want to join when you're first eligible to avoid a potential late enrollment penalty. The penalty to join a prescription drug plan after when you should have is nominal. It's very low, but they charge it every month, every year for the rest of your life. So you're always going to pay a penalty, and that's just the way it is. So it adds up. Even 1% adds up to 12% a year, and that adds up year after year. So just make sure that you join when you're first eligible to avoid a penalty. Now, Medicare Advantage members, remember those drugs are built in. You cannot purchase a standalone drug plan because the government doesn't want you to have 2 drug plans at once. They want you to have the plan that comes with your Medicare Advantage plan because Part D drug plan is embedded into the Medicare Advantage plan design at no additional premium. Again, I mentioned always check the plan formularies to make sure your drugs are on that list. I talk about my mom now. My mom took a inhaler that was $660 a month. And it was about 5 years ago, I had to find a drug plan for her because she did join a Medicare supplement plan. So I went through all the plans and it was $660. Nobody covered it. so she had to pay out of pocket. So again, $660 a month. I found one drug plan that covered it at tier 3 for $30 a month. And again, this was about 5 or 6 years ago. So I was able to enroll her on that plan, saved her $630 a month for the year. But I only use that example to make sure that you know that if you have that one drug that might be expensive or that you're paying out of pocket for, check all the formularies. Have a Shine counselor help you check all the formularies for all the plans, because you might have the same thing happen. You might find that one plan that covers your prescription drug at a lower cost. And we're all about saving money, right? We all want to save money. Now, people always ask me, what should I consider if I'm joining a plan? I always say, consider your budget. Do you want a plan with a lower monthly premium and have a higher cost sharing or higher co-payments in the end? Or do you want a plan with a higher premium with no co-payments? Remember, my dad wanted the plan that cost more, so he didn't have co-payments. And you might be in the same boat, you might not be. Medical usage, do you see a lot of doctors or do you see very few? Do you go a lot, or are you only go for your physical every year and not really go to the doctor that much? That might have an impact on the decision you make for which plan you want. Flexibility, do you prefer to have a network? Do you prefer to have coordinated care and stay within a network, or do you want to have no network and no referrals? That's really up to you. Do you have a desire for extra benefits? Do you want the dental benefits? Do you want the cleanings? Do you want the eye exams and the hearing exams and the hearing aid allowances? If you do, then we all know that that would be the Medicare Advantage plan. Prescription drugs, are your medications covered on the plan you're choosing? I just told you that example with my mom. Make sure your medications are covered on the plan that you decide to enroll on, because that's going to make it a lot easier for you. Final review. Remember, MedX or Medicare Supplement Medigap plans are typically more expensive. They have a higher monthly premium than Medicare Advantage plans because they don't have copays. So you can see any doctor in the country that accepts Medicare. There are no referrals necessary, no co-payments, and like we showed with Lou with the case study, there are predictable costs, which is good. Medicare Advantage plans, typically less expensive monthly premium, could be as low as $0. There is cost sharing or co-payments for services. Most plans include Medicare Part D drug coverage and additional benefits like the eyewear, the eye exams, the routine dental. You're going to use network providers. It's coordinated care in that regard. You're going to have co-payments whenever you receive care. And as this young lady mentioned earlier, there's an out-of-pocket maximum for your protection. So that's where it was going to come up on the slide. Helpful resources. So this page is pretty great if you want to contact the government. They're up top. The Centers for Medicare and Medicaid Services, or CMS, they make their website and phone number pretty easy to remember, 1-800-MEDICARE or medicare.gov. Social Security's website is really awesome. I love it. I'm kind of a geek. I go on their website all the time. SSA.gov, and their 800 numbers there. I think the closest office here is it Holyoke? Is there an office? Oh, in Springfield. Good to know. So right down the road. Excellent. I mentioned Shine counselors earlier, and I said that most senior centers in Massachusetts have them assigned. That's an acronym, serving the health information needs of everyone on Medicare. So you have shinema.org. If you want the assistance of a Shine counselor, see them now and make an appointment, because in October, their calendars are going to fill up and they won't have time for you. So definitely do that. The Mass College of Pharmacy and Health Services started an outreach program where you can speak with a live pharmacist or a case manager at no cost about medications. You might be worried about side effects. Maybe you're taking something and you're worried that it might conflict with another prescription you're taking. They're really great. They'll help you out with that, and it won't cost you a penny. Prescription Advantage is a program in Massachusetts that also, if you qualify, won't cost you anything, and they'll help you pay for your drugs. And I do know that they don't take your assets into consideration when you apply. It's strictly income-based. So if you fall within a certain level of income, you will qualify. And like I said, it's pretty simple. They'll help you pay for your drugs if you need help. And finally, Blue Cross Blue Shield's website and phone number are on that page as well. And we are done. So thank you so much for joining us today. I'll stick around for questions, and I appreciate you all spending an hour with me.
I have one question.
Of course.
On the prescriptions, does chemo come under that?
Chemotherapy does fall under what they call Part B, so it is covered under your medical plan, typically.
But if you don't have the Part B and you choose the other.
The other Part D, you're going to want to check with a drug plan that you choose. Remember, there's a bunch of them. I said there were probably 12. You want to check with them and make sure they cover chemo drugs when you enroll on them, because they're all going to be different.
That could be a problem.
Yeah, generally it's covered, generally, but I can't speak for all of them. So, yeah, great question though. Thank you. Yes, ma'am.
What about foreign travel?
Great question. Foreign travel's covered for urgent care and emergency care. You're covered anywhere in the world for those services. Emergency care or urgent care. Routine care, not outside the U.S. On any of the plans. But if you have an emergency or an urgent situation, you're going to be covered. Now, if you have to pay up front, let's say you're in Ireland and you're not a citizen, so they want you to, hey, no worries, and they want you to pay with a credit card. If you're going to the hospital there or something, pay with your credit card. When you come back to the States, let us know, show us proof that you paid, and we'll reimburse you. Okay?
One more question.
Of course.
All of the agencies that are dealing with these plans like Blue Shield, they have the same, they're offering the same thing, nothing, no different, better or less.
Remember I mentioned CMS, the Centers for Medicare and Medicaid Services. Everyone has to submit what they want to do next year for their plans and their rates to the government over the summer. The government writes us back or contacts us and say, you know what, these plans are great, but you have to change this one, you got to change this. They don't want one plan to be significantly less expensive or significantly richer in benefits than the other, because that creates an unfair advantage for them. They want us all to be kind of in the same ballpark. So there might be nuances as far as the rates or the benefits. One plan might offer, $300 for fitness, whereas another plan might offer $150. So you're going to find nuances like that. But
So you said that there's how many in Massachusetts that deal with this?
Oh gosh, there's
I know you mentioned that there's
10 or 12 drug plans, but we've got like Tufts Health Plan,
Right.
Fallon, Blue Cross, United, Humana.
Okay.
Yeah, there's probably 7 or 8 in Massachusetts.
How do you shop?
You can go to a Shine Counselor is probably the best way to go.
Okay.
And I can't tell you what plan to go on. I like to tell people that, the only person who knows what plan's right for you is you. I can tell you about Blue Cross's plans, and I will do that at a sales seminar, but I can't tell you what to go on. I can't say, Lou, definitely go on this plan. It's better for you. But a Shine Counselor can definitely do that.
It seems like the basic information that we're receiving is really what we really need.
And you'll get a lot of it. Your mailbox should be filling up now with every company you can imagine. Joe Namath on TV is going to give you that 800 number 45 times in 45 seconds, right? Be careful when you call that number. If you call that number, you're going to be hooked up with an agent somewhere across the country who is not going to know where East Longmeadow, Massachusetts is. All right? And I get the question, I'll get it 100 times this year. Why shouldn't I call Joe Namath and why should I join you guys? I say, you can do what you want. I can tell you about my plans. He can tell you about his plans. But his plans are going to be a national plan. And if you ever have an issue, and you come back here in a month and say, do you have that Blue Cross guy's number? I need him to come here. I have a problem with my bill. She'll call me, and I'll be here in an hour and a half. Joe Namath won't do that. So great questions, though. Thank you.
Can you ever change your plan during the year?
Can you change your plan? Awesome. Can you change your plan?
Well, I'm just asking.
Yeah, no, I asked if Blue Cross, no, if you can change your plan. Great question. Believe it or not, you can change your Medicare supplement or MedX plan month to month to month to month. Crazy, right? You can change from a core plan to a Sapphire plan or the 1A plan back down to the core plan. If you're having surgery and you don't want to pay that $1,676 deductible, you can change every month. But on the Medicare Advantage plan, the only time you can change that plan is the first 90 days of the year. They have what's called the Medicare Advantage open enrollment period. You can change your Medicare Advantage one time, same carrier or a different carrier, or you can go back to original Medicare. And once April 1st comes, you're on that plan for the rest of the year.
Oh, so you can actually change your carrier?
Yeah.
Within the first 90 days?
Yeah, yep, you sure can. Yeah, it's good stuff, yeah. So I thought you were asking if Blue Cross can change our plans. If we ever change our plans mid-year, which never happens, we have to let you guys all know 90 days ahead of time with a letter, but that's not gonna happen. Yeah, yes ma'am.
I found the problem with Advantage plans that some providers, they drop the plan. So then you're stuck.
They can. It's unusual, but it happens with every carrier. Every year it seems to happen. There might be one medical group that doesn't want to renew for one reason or another. It's unusual. but it can happen. And again, if it happens, we have to let you know way ahead of time that this is happening. They can't just drop in a month. They have to give us at least 90 days notice. So we have to, by law, we have to let you know and give you 90 days to switch your plan if you need to do that.
Well, see, I had United Health, they dropped a provider in July.
Yeah.
And I was stuck.
Yep. And they should have given you a buffer time to choose another plan. So the government, generally if that happens, the government will say, okay, you can actually join a different plan. We're going to give you a special open enrollment because you're involuntarily losing your doctors, right? You didn't voluntarily leave the plan. They're doing that. So they might offer you a special open enrollment period of time to change your plan during the year if that happens.
Well, they want you to choose a doctor, but the problem is that all the primary doctors are booked up.
Yeah.
Don't take any
Yeah.
patients.
Right. That's true. That can be true. So it can be harrowing. Again, Shine counselors are amazing people. And of course, if you're on United, call their customer service. If you're on Blue Cross, call our customer service. Turn your card around. There's a number there. They should be able to help you primarily. And if they can't, see the Shine counselor. And if they can't, she'll call me to come down and help you.
I have a quick question. Your people at the other end of that number, are they local
Yeah. Yep.
or are they Filipinos?
Oh.
No offense against Filipinos, but when I call United Healthcare, they're all in the Philippines.
I can
Some
only.
of them are very good and some
Yep.
of them are not.
I hear you. I've called Amazon a few times. Yep, I know, and it's okay. I have nothing against Filipinos at all. They're all great people. However, I can speak only for Blue Cross. Blue Cross, all of our customer service people are employed by Blue Cross in Massachusetts. They work out of their homes, believe it or not. When the pandemic hit, Blue Cross sent everyone home. A lot of us are coming back to the office now. I go to Hingham and Worcester, but the customer service people, most of them work out of their homes. So they're all Massachusetts-based, generally. Yeah.
Sometimes
Yep.
you get a person that can't comprehend or they can't understand them.
Exactly. And that can be a problem,
So if I already have the supplement plan through United Health,
Yep.
Excuse me.
is it better to choose an agency, local agency instead of United Health?
That's really up to you. What I would do is if Blue Cross or Health New England intrigues you, maybe go to one of their sales seminars. Go on their website and see that we've published our seminar schedule for the fall. So all of our meetings are up there. I'm personally going to do the ones at the La Quinta in Springfield, and then we just signed up with a hotel in Northampton, not the Hotel Northampton, but the other one. We're doing meetings there. I think there's the only two we're doing out in Western Mass. We're doing meetings in the Berkshires, but you don't want to go to the Berkshires, right? Unless you're leaf peeping. Worcester, we do meetings there. But out here, I'll do the La Quinta. I think we're here 3 or 4 times in the fall. So come to our meeting. It's a 2-hour meeting. We do an hour in Medicare Advantage. We do an hour in Medicare Supplement and Drugs. Yeah, but it's a lot of information, and we give you all the materials for next year. And we're not allowed. We're not allowed to serve food, believe it or not. We can give you snacks, but we can't give. We're not allowed. No, I know you are, but the reason why, just so you know, is we're not allowed. The government sees it as an enticement,
So where are you going to be? La Quinta?
The La Quinta in Springfield, right on. It's a Congress Street or Dwight Street. It's downtown.
Used to be Holiday Inn long time ago.
Yeah. We're usually on the top floor, so if you go in, you'll see our signs. You'll be able to find us. Yep. So thank you, everybody. I'll stick around for a few more minutes and answer questions if you have any.